The goal of my talk today is to tell you a little bit more about what we're doing to harness the innovation potential of our wonderful employees. And I think it's a really nice transition from the last talk, which really laid the groundwork and set the stage for the opportunities in healthcare to solve. And I also think his closing comments about how do you really grow and develop a culture of innovation at your facilities and organizations parlays very well into this talk. So the way I'm going to structure it is first I'm going to tell you a little bit more about this initiative called the VA Innovators Network, which creates innovation pathways tied to strategic priorities for the Department of Veterans Affairs. Secondly, I'm going to give some examples of those projects. Similar to how he ended his last talk, we've seen that letting 1,000 flowers bloom is not the best way to develop an innovation strategy, but it really needs to be tied to your strategic priorities. And for us, that's improving access to mental health care and really helping to improve and solve some of the complex challenges that our veterans and their families face. And the third way I'm going to end this talk is by talking a little bit about some heuristics that all of you can use in your respective organizations to develop a culture of innovation. So to give a little background on why at the VA we wanted to do a better job of supporting the development of an innovation culture. If you all remember, about 3 years ago now, the VA was in crisis. We were all over the national media, and frankly, we weren't doing as good of a job as we could to serve our nation's veterans and their families. And at the heart of the issue was that our employees did not feel comfortable seeing and solving problems that were impacting veterans and their families on the ground at the source. So we at the VA wanted to do a better job of helping to empower and engage our employees to see and solve problems on the ground using innovation principles. In addition, we at the VA, we're the nation's largest healthcare system. We have over 150 VA medical centers, which are about the size of average hospitals in this country. We have over 800 community-based outpatient clinics. And so we wanted to do a better job of identifying what is working and then sharing that and integrating that across our large healthcare system. There was an Institute of Medicine report that showed that on average, it takes about 16 to 18 years to deploy evidence-based practices in full scale. And that is just not acceptable in this day and age. And so we at the VA wanted to do a better job of finding out what's working and also sharing that and encouraging our employees to pick up those ideas. And I'll give some examples of how we've accelerated innovations across our organization. Secondly, we wanted to take advantage of our existing brain power and talent. I truly believe that we have some of the most incredible employees at the VA. 40% of our workforce are veterans themselves. We don't really talk about that a lot in the media, but veterans are serving other veterans at the VA. And a lot of our clinicians and other frontline administrators and providers could work in other healthcare systems, but they work at the VA because they want to serve veterans and their families. And we really want to honor that and really harness their incredible brain power that they have at the VA. And third, we want to retain our employees. With all the media and all the bad press about the VA, even though we do an incredible job of serving veterans and have a long way to go still to improve, we were losing employees. And so we wanted to arm them with new tools, new skills that you see a lot happening in Silicon Valley, et cetera, to arm them with new tools and skill sets for their portfolio. And so what we did is we traveled across the country, we interviewed hundreds of veterans, and we also interviewed hundreds of VA employees. And we heard about, in particular, the employees' innovation experience at the VA. And we heard from our employees that innovation at the VA felt like a fight, hiring, contracting, IT were the devil's triangle. And overall, they felt like they didn't have a forum to express ideas and solve those ideas. So then we went back out into the field and co-designed with veterans and employees this initiative called the VA Innovators Network. And our goal with the VA Innovators Network was to create a safe space for VA employees to test new ideas and collaborate with members of the veteran community to develop the best possible experiences for veterans and their families across this country. And what we did in our first year is we set up this initiative at 8 VA medical centers, and now in our second year, we're currently at 22 VA medical centers. And I'm proud to say in the next fiscal year, we're going to be growing by about 10 more sites. So we'll be at 32 VA medical centers across the United States. And our goal was to really share what the important things that we needed to be solving for veterans, such as access to mental health care and access to care, and really harness the brain power of our existing employees. And one of the main ways we did that is we stood up a new capability called an innovation specialist at these VA medical centers to really work alongside VA employees, teach them these new skills. We knew we weren't going to be able to hire our way out of the access to care problem. We knew we weren't going to be able to hire our way out of recruiting, hundreds of folks from Silicon Valley and the Boston area ecosystem to develop new innovations and new approaches. So we really doubled down on how can we teach and train our employees on new skills, new innovation opportunities to develop the best possible experience for veterans and their families. So we started with training a crew of innovation specialists across the VA. And this position was actually modeled after positions that we saw at some of our collaborators, such as Kaiser. We work pretty frequently with Kaiser through this organization called the Innovators Learning Network, which if you haven't heard of, I encourage you to check out. It's a group of healthcare innovation stakeholders from across the US. We also model that after positions we saw at Brigham and Women's Hospital and MedStar and beyond. So really trying to leverage things that we saw working across other institutions. And their role is to really develop a culture of innovation at their respective VA medical centers and collaborate across sites. And we had 3 main goals for this network. And the first was to teach and train employees on innovation-related competencies like design thinking and entrepreneurship, and those that wanted to learn how to use the various tools related to informatics, et cetera. And in our first year, we trained over 1,100 employees. And one of the outcomes that we were really surprised to see after 1 year is that in our Federal Employee Viewpoint Survey, which is an annual survey given to all VA employees, after 1 year, all of our medical centers that participated had a 2.5 times higher innovation, creativity, and psychological safety score. Now, if you haven't heard of psychological safety before, it's a factor where you can measure how comfortable your employees feel raising problems or raising new ideas. So this was a really important metric for us at the VA to measure because this was at the heart of the crisis that we saw at the Phoenix VA. So it was wonderful for us to see that this program really helped improve the psychological safety of our sites. Secondly, we wanted to create an innovation development pathway tied to strategic priorities of the VA. And we provided investments and training programs through an accelerator model to help develop new innovations. And I'll give some examples of those on the coming slides. But I'm really proud to report that after 1 year, we had a return on investment of our first year of projects. Also, we saw incredible improvements in access to care with some of our innovations allowing veterans to be seen within same day, which is a really critical metric for us at the VA to improve care and services to veterans and their families. And our third goal was to really help support diffusion of innovation so that we're not operating as 152 individual VA medical centers. For those that know the VA, one of the common phrases you tend to hear before is, if you've been to one VA, you've been to one VA. So we really wanted to help improve that and help really operate as a network in this integrated system to share things that are working. So the way we did that is instead of doubling down and paying a lot of contractors to come in, we really wanted to help support employees in their innovation journeys and arm them with these new tools. So we engaged over 440 staff in our first year that developed new innovations and approaches. We had pitch workshops with veterans and employees, and we had a number of different training programs and events. And after our first year, over 124,000 veterans were touched and experienced new care and services from VA Innovators Network innovations in 1 year alone. And so this showed us that if we can do a better job of harnessing our existing scale, then we can do a better job of serving more veterans quickly and more effectively. So one of the main ways we did this is we borrowed plays from Y Combinator and some of the health tech accelerators out there like Rock Health and HealthBox. And we developed an accelerator model called the VA Innovators Network Accelerator. It's a 5-month sprint that kicks off with a boot camp. We have every other week training webinars to really teach and train our employees on new skills, like how to develop business models, how to communicate your innovations, how to show the value. And then it culminates in a demo day in front of veterans and senior leadership. And our goal is for veterans to then evangelize a lot of these innovations and share this with other veterans across the country as well. And we provide 3 tiers of funding to our employees. And this is a play that we borrowed from the Department of Education. Because one of the problems we were facing is that we would deploy large amounts of money, and it wasn't really done in an agile way. So what we did is we started deploying microgrants. The first tier funds is a spark investment, about $5,000 to help support proof of concepts. Second tier funding is a seed investment, about $50,000 to do pilots and tests of innovation. And then a third tier funding is called a spread investment. And this is up to $200K to help spread innovations that are working and share them across other VA medical centers. So this was our way of testing small, failing small, and then really trying to harness the brain power of our VA employees in the process. So just some examples of the innovations that have been developed in the past year. The first is a program called Creative Wellness Program or Creative Expressions Program. And one of the things that they were seeing at the Brockton VA is that traditional mental health care pathways were not working for many veterans. These are veterans oftentimes of the Korean War and Vietnam War population that frankly never got the care that they needed and deserved. And so what they did is a team of social workers started doing all sorts of different types of therapies. They started doing poetry and painting and singing and farming. Farming therapy was just such a powerful tool. And they found that they were able to reduce hospitalizations by 90% for this very sick inpatient mental health veteran community. They would go out to parks and find veterans that were living there, and they would bring them into their programs. Some examples of the impact are veterans that they've pulled in from parks and in the streets have come through, received services, have gone to college, and now are employed. And they actually co-run this program now. And that's really important for us at the VA, is that it's a collaboration between VA employees and veterans helping other veterans, because they're incredible peers. Another example is of a program where we were having issues with adherence to cardiac rehabilitation. And so an employee out of the Atlanta VA developed a program on a smartphone that helped improve cardiac rehabilitation. And they saw a 275% increase in cardiac rehabilitation adherence. They saw improved health outcomes, and they saw reduced ED visits. And this is all after a 6-month implementation deployment. And the employee that ran this innovation just won an award from the American College of Cardiology for this work and is now spreading to other healthcare institutions. And so this is a good example of, frankly, an innovation that we were pretty skeptical of. Many of the Vietnam and Korean War veterans that we worked with, we didn't think would want to use the smartphone applications based on feedback we'd gotten from them. But they loved it because it meant they didn't have to travel the 30 minutes to 1 hour to oftentimes up to 3 hours in some cases into the VA Medical Center for their cardiac rehab programs. And then another example of an innovation is using design thinking. We really worked with veterans and worked with the ED staff to develop a better pathway to triage veterans that were coming into the emergency room for care, so they got more timely care for their mental health needs. So I mentioned that along with, of course, our first priority is improving the veteran experience and improving health outcomes. But we also need to be good stewards of taxpayer dollars. And so in our first year, we spent about $3 million on this entire program, and we got a $3.3 million return on investment. Typically, in the private sector healthcare institutions, you see a return on investment of about after 4 years, and that's based on my past experience working in healthcare innovation ecosystems. So we were really proud of this program, the fact that it was able to generate this ROI so quickly. One of the examples of the programs is technology-based eye care services. Many of our veterans were traveling 3 to sometimes 5 hours in for pretty routine eye exams. So we started doing telehealth work in our community-based outpatient clinics to help improve eye care services. And this work allowed 70% of veterans to be seen same day and 99% of veterans to be seen within 14 days. And this also helped us save money on travel, et cetera. Another example of a program is our high-risk, high-cost medication repositories, where we really go through and look at our patients and look at the medications they're taking and try to decouple them and making sure they're on the proper formulators and that they're on the best drug for them. And this has really helped improve patient safety issues with us. This has also helped us reduce costs in the meantime as well. And then the last example there is we've started to really improve our screening programs and going to where veterans are coming into our systems. So in one of our substance abuse clinics, we started deploying hepatitis C screening. And we've seen a 270% increase in the number of hepatitis C diagnoses. And this allows us to get the care these veterans deserve much quicker and faster, and thinking of the different care pathways that we have to serve veterans and their families. In the process, and why I'm really happy that all of you are in the room, we really want to partner with the private sector because we want to accelerate our ability to serve veterans. And so you can see a number of the organizations we've partnered with. Recently, we signed an agreement with Stratasys, which they've provided 5 3D printers to 5 different VA medical centers. This allows us to 3D print assistive technologies and personalized technologies for veterans faced with disabilities. So veterans that are wheelchair bound, that can't reach microwaves, veterans that have upper and lower extremity prosthetics. One example is a veteran out of the Richmond VA, and since his upper extremity amputation, he hasn't been able to take pictures like he used to before his amputation. He hasn't been able to ride his motorcycle. So we've developed 3D printed designs that serve as extensions to his prosthetics so that he can perform these services that he used to before his amputation. And we also partner with folks across the VA to accelerate the development of innovations, but I'll get into that a little bit later. And then one unintended consequence of this work is that it's resulted in a lot of positive press, which that wasn't our goal, but we really had a huge morale issue at the VA. And so for those that are looking to start new innovation programs that perhaps have morale issues or are looking to really share the good news of your work, innovation programs have been such a great opportunity for us to share the great work of what we're doing. And most importantly, this allows us to rebuild trust with veterans because we lost that trust 3 years ago during our crisis. So some other examples of some of our projects that are in the more of the informatics IT realm. This came out of the Atlanta and Portland VA. That's a picture of the paper created in one day to transfer records to the private sector. We at the VA give veterans a choice. They can come to the VA or they can go to the private sector healthcare for their care. Oftentimes we're finding that veterans actually want to stay at the VA because we can treat the patient a little bit more holistically. But in the event that veterans do go to the private sector, we want to make sure that the providers there have all the information. Now, I'm sure that picture is familiar, unfortunately, to many of us in the room, despite the fact that it's 2017. So we were having interoperability issues. So the Atlanta VA developed a prototype that took the time down from 20 to 25 minutes that it typically took to send records to the private sector, down to 2 to 3 minutes with a quick prototype. They then shared this tool with the Portland VA, who developed a web-based application. And now over 120,000 veterans' records have been created. And this program went from 1 to 2 sites to deployed across the entire VA in less than a year, which is pretty crazy when you think about the time it takes to deploy and operationalize IT solutions in a large healthcare system. This is an example of the screenshot of how it works. It's very simple to use. Honestly, this isn't best in class, but it works. And we definitely need to keep thinking differently on how we do interoperability, not just at the VA, but across the country. This is another example of a tool that was developed called ReachVet. There are on average 20 veteran suicides that are taking place every day. The majority of these suicides are with the Korean War and Vietnam War population, which is a statistic that many folks don't know. So we at the VA wanted to do a better job of identifying early warning signs for veterans that were at risk for suicide. So we combined different tools, different data sources from across the VA and beyond to predict who was at risk for suicide. This is currently being deployed and tested in a number of sites at the VA because we have to be careful with this. We don't want to identify someone that isn't at risk and then what could result from that. So this is a really important project for us to really help early identify veterans that are at risk for suicide. Another example of a tool is that, frankly, we were hearing from our providers that the amount of screening time that psychologists and psychiatrists and social workers had to do as part of the encounter was too much. They weren't getting that time that they needed in front of veterans to have conversations and deploy the proper therapies. And so we developed a tool called e-screening, which allows veterans and their caregivers and their family members to do those questionnaires prior to coming to the appointment. So that way they could really protect the sanctity of that patient relationship in that time. And you can see some of the outcomes. 20% of more veterans got same-day care with the services, and we were able to really identify veterans that are at risk for psychological health needs and get to them into our system earlier. So the third part of the talk is I want to summarize some of these heuristics for all of you so that if you're looking to develop a culture of innovation or expand on your current innovation services, that you can take these back to your respective organizations. So I recently read an article in Fast Company that says the 6 ways to create a culture of innovation. So kind of leaning on those insights from that article, I kind of redeployed it for a healthcare innovation ecosystem conversation. So I'll go through each of these on the coming slides. So first is the approach to be intentional with your intent. Parlaying off of what Dr. Madison talked about is don't just develop innovation for innovation's sake. In fact, 80% of innovation centers or innovation initiatives at organizations fail. And one of the major reasons for that is because they're just trying to do innovation for innovation's sake and use buzzwords like innovation, design thinking, entrepreneurship, some of the terms I've used during this talk. But in fact, what you really need to be doing is setting your strategic priorities and being very specific. For us, it's access to mental health care and access to care for veterans and their families, and also better managing complex diseases that we see at the VA. So here are some examples on the screen. The first is out of our Milwaukee VA. They really wanted to improve HIV screening and innovations surrounding that. So the Women's Health and Leadership at the Milwaukee VA developed an entire program to improve HIV screening rates. They took their rates from 20% to over 95% in 1 year's time. And that was really important to us to get veterans early in who needed care. And I always try to equate this to what President Kennedy did with the Moonshot Initiative. He was very specific about landing a man on the moon by the end of the decade, and that's what he was able to do. So be intentional with your intent. Second is create a competency. So there's a lot of work that's actually come out of Dartmouth, Dr. Govindran, and his team studied countless innovation initiatives across private sector organizations. And they found that a lot of innovation initiatives go wrong for 2 reasons. First, they created as this special forces rogue group, the DARPA, that is separate than the rest of the organization. And they don't understand the real needs of employees and patients and their families on the ground. And so they have this sort of immune reaction when an innovation initiative is deployed. The second bad form that he observed in his 10 years of research was when the innovation initiative was almost too embedded. And it was too embedded in the performance engine of what he called the regular operations, so that they really weren't given the opportunity to think differently, and the operations of the organization brought innovations to a screeching halt. Because by definition, innovation is operating at the fringes. And by embedding it too much, innovation was being stopped before it had the opportunity to get started. So what we did is, leveraging this research and leveraging work to co-design this with the VA, we deployed this innovation specialist, which had ties to the VA Center for Innovation in Washington, D.C., but was still a part of the respective VA medical center. And it was really important in his research that you developed a capability that had their feet in both. So just something to think about in your respective organizations. And then the third thing is, you really want to create a structure for unstructured time. So with us, this was creating pitch workshops and accelerators. And one of the single biggest things we heard from our providers, and we also saw in private sector healthcare entities as well, is that time was the biggest factor for why folks weren't innovating or thinking differently. And so what we did is create a structure through these accelerator programs and these funding programs. And we've trained thousands of VA employees through these programs. Fourth is, you can't just expect folks to understand and learn these competencies, so it's really important to provide training and support, and also to help ease folks up the spectrum from novice to beginner to intermediate to expert. And so we've deployed a lot of train the trainer programs, where employees that come to our trainings then have to teach back to employees in their service lines. Fifth is, we want to create a network to help diffuse innovations. And we really want to lean on a lot of Everett Rogers' work. If you haven't read about Everett Rogers, he did some work in the 50s and 60s to look at diffusion of hybrid seed corn in Iowa and Kansas. And he did this study to identify what are the factors that really allow organizations to really diffuse innovations across the enterprise. And just to give another real-life example of that, and our failure in healthcare as well, this is an example that Don Berwick has talked a lot about. Has anyone seen this example before from Don Berwick? I see some heads nodding. So it showed that Captain James Lancaster actually had a definitive solution for scurvy. He was able to link it to vitamin C in 1601. It then took another 264 years, if you can believe, for it actually to make its way into policy. How sad is that? We had a solution to help save lives, and there was no great way to disseminate it. And in nowadays time, we have communication tools, but as I mentioned earlier, that IOM report still says that it's taking on average 16 to 18 years to diffuse evidence-based practices. So what we wanted to do at the VA is to identify a way to harness these lessons from Everett Rogers and the work that Don Berwick often talks about, and we created a model for disseminating best practices. And the way we do this is we identify promising practices through a Shark Tank effort. We deploy this across all of our 152 VA medical centers. This past go-around, we had 300 submissions of best practices. We had a Shark Tank where the medical center directors across the United States served as sharks, and they then bid resources in a very resource-constrained environment, mind you, that they could actually bid resources on the practices they found most valuable. And that was our metric to deciding what we should invest in to spread, if people are bidding their own respective resources to bring that practice to their site. So really relying on market-driven mechanisms. We then identified those practices, found champions at implementing sites, and then started to diffuse them, and then really established consistent and standard practices that could then be deployed across all 152 VA medical centers. Sixth is to recognize and celebrate. This is critical. Really award and recognize the employees that are doing well and stepping outside of their natural comfort zones, and also are breaking the rules and really making a difference. So we do that through a number of different ways, through our demo days, through our Week of Improvement and Innovation Awards. And then last but not least is make sure to measure the impact. This goes without saying, but too many innovation initiatives are just innovating for innovation's sake. And so we like to think of innovations according to a number of different lenses. First is this improving the experience for veterans and their families? Secondly, is it improving clinical outcomes? Third, are we being good stewards of taxpayer dollars? Fourth, are we improving efficiency and saving time? Also, are we improving the employee experience in the process? And last but not least, are we improving society value as well? The VA has been the home of a number of different healthcare innovations. The first liver transplants, pacemakers, the nicotine patch. I could go on and on and on. And we at the VA see ourselves not only serving veterans, but also serving greater public health. So when you're developing an innovations portfolio, make sure that you measure the impact as well.
Thank you.